Hello everyone. So tonight's story is going to talk a little bit about documentation as well as communication. So first of all, let's talk about the purposes of documentation. The purposes of documentation are listed in your fundamentals book and basically are to provide a source of communication as well as legal representation in the event that there is a medical error. Remember, if you did not chart it, you didn't do it. We must be documenting all of our assessments, all of our interventions. When you sign a document, when you sign any piece of documentation, remember the proper method to sign documentation is to use military time. We talked about military time and how to calculate that. And one of the easy ways that I like to calculate military time is knowing that you have the 1 through 12 on the clock. So if it is in the afternoon, then say it's 2 p.m. I add 2 to that and I get 4. So instead of becoming 2 p.m., it becomes 1400. If it is 3 p.m., I add 2 to the 3 and it becomes 1500. If it is 4 p.m., I add 2 to the 4 and it becomes 1600. So that's one way of calculating it. I'm sure there's other ways you can calculate military time, but that's just the easy way that I found that worked for me. Another thing about documentation is, remember, there's different types. There's narrative documentation, there's problem-oriented documentation, which is the documentation in which people will chart by exception, which means you're only charting things that are abnormal and not charting the normal things. There's pie charting, which is problem, intervention and evaluation, and there's also SOAP or SOAPy charting, subjective, objective, assessment, planning. If you go to the I and the E, it's intervention and evaluation, all which follow the nursing process. You also have a focus type of charting, which basically is charting the data. It's also charting your action and then the response, which again follows the nursing process because you have to chart your assessment, you have to chart the action or the plan, and then you have to evaluate whether or not the action, the implementation piece of your action during the day was effective. So there's a lot to understand about charting, but using these methods can also help one to figure out what needs to be charted and what doesn't need to be charted. Remember, when you are charting, you want to stay away from subjective comments and focus in on objective data. Okay, another thing I just want to talk about briefly in this little story is communication. Remember, when we are communicating as a nurse, that we must use therapeutic communication. Therapeutic communication involves open-ended statements. What I mean by open-ended statements is we don't want to necessarily boss somebody around or basically disregard their feelings. We want to always use statements that encourage communication. Tell me about how that makes you feel. What is it about your condition that you need more information on? I'm sorry that you feel that way. Is there something I can do to make it better? You always want to have open-ended communication and pay attention to not only the verbal responses that you're getting from your client, but also the nonverbal responses. Nonverbal communication is going to be something that is going to direct you to figure out what it is that you need to teach your patient and whether or not they are understanding what it is that you are trying to teach them. It also is an important piece of documentation. Whenever you're doing any type of patient teaching, make sure that you document whether or not the patient verbalized understanding, whether or not the patient demonstrated the procedure, whether or not the patient read the directions and verbalized to you that they understand what they're supposed to be doing when they're taking care of their own needs. On that piece of documentation, we talked about military time, but we didn't talk about the signature. Remember, the signature should always be your first initial, your last name, followed by your credentials. So for a student nurse, that would be Susie Smith, S. Smith, comma, SPN, student practical nurse. Okay, well, that's all for this bedtime story. It was short and sweet. Good night.